It's 9 a.m. from Fox 35. This is Good Day Orlando.
Botox, not just for getting rid of wrinkles on your face anymore. A plastic surgeon explains why more women are using Botox for their calves.
Yeah, that one just sounds strange to me. More women are getting Botox injections, but not where you might think, in their calf muscles. Up next, a local plastic surgeon explains the unusual new trend. Is it safe? Welcome back. Trending right now, you know, millions of people get Botox injections to get rid of fine lines or wrinkles on their face. But now, another use for these injectables is becoming quite popular. Women are using Botox injections to slim down their calves because they want to either fit into skinny jeans or tights or boots. Dr. Armando Soto, board-certified plastic surgeon from Aesthetic Enhancements, is joining us this morning to talk more about this. Great to see you as always.
Thank you, Amy. Nice to be here.
This sounds bizarre to me. What do you think about this?
It sounds a bit bizarre to me, too. You know, I think that as people have learned more about what's possible and how Botox works, you know, fundamentally it relaxes muscles.
Right.
Individuals, you know, patients have sought new ways to improve their bodies and faces through this use. The problem that we have with placing it in places like the calf muscles is that those muscles have important functions.
Sure.
You know, when you walk, when you stand, you know, they have very important functions. So there are some women, mostly in Asia, who are using this to allow the calf muscle to shrink through the paralysis, and that lets them put on skinnier jeans and slim boots, which aesthetically might be pleasing, but, you know, I think they're having a little bit of a hard time walking and certainly running.
Yeah, it doesn't sound like long-term, maybe not such a great idea.
Yeah.
I know it wears off, right?
Yeah, it wears off after 3 or 4 months. You know, this falls into the category, and this comes up in my practice often. You know, I tell my patients all the time, there are lots of things we can do, but the real question we should be asking is, should we do?
Right.
And so that's where you need somebody to guide you.
Okay, so say you do want maybe slimmer calf muscles, which I don't know. I've always been of the frame of mind that you want your calf muscles to look good and defined and to grow them. But if you do want slimmer ones,
right.
Are there things you can do to slim them down without having to get an injection?
Well, you can go the old-fashioned exercise route, which is, I think, usually preferable. But other than that, you know, there are things we can do with liposuction and things like that with refinement and technique. I'm not sure that I would advocate for Botox in the calf muscles.
Yeah, I think that sounds a little too much.
Yeah,
and I'm sure you get strange requests all the time. I'm sure people have come to your office and they ask for something and you're like, yeah, not a good idea. I mean, it's your job to say that sometimes, right?
It is, and sometimes it's difficult because people have read on the internet about things and they've seen that other people have done it, and you know, people want to say that they're happy with something they've done because they don't want to say, oh, I made a bad decision.
Sure.
So they think that it's a good idea, and sometimes it's really difficult to explain to them why it's not such a good idea. And some people, I'm sure, go and get it somewhere else. But, you know, I think it's important for us to always do what's best for the patient, even if they don't see it that way.
Absolutely. What is your website again?
It's www.drarmandosoto.com.
Fabulous. Always a pleasure. Happy New Year, Dr. Soto. Great to see you.